Brought to you by Polident and Super Polygrip.
Well, people who are constantly on the go often forget to unplug and recharge. The CDC reports that 35% of adults don't get enough sleep, and doctors say that this can be detrimental to long-term health. Dr. Alcibiades Rodriguez joins me now to talk about the ways in which sleep impacts the body's overall health. Thank you very much for joining us, doctor. So what would you say most people don't understand about sleep?
Thank you for the invitation. The first thing I need to understand and to sleep well, you need quantity and quality. So everybody talks about the 8 hours minimum. Well, some people can function with fewer hours, but actually some people may need more hours. Sleeping more not necessarily means you are healthier. It means a sign that you have a medical problem, like obstructive sleep apnea. The same way, quality of sleep is important. Some people may need 9-10 hours because they're compensating for the lack of quality at night.
Why is that when you get older that you don't sleep as well? You hear this often.
Sleep gets lighter, so we don't get that deep sleep like we used to have as we were younger.
And is there something you can do to improve that sleep, so you get that deep sleep?
We think no, because the brain shrinks as we get older. We love synapses. And we think the lack of synapses...
What's synapses?
Synapses is the connection between neurons. It's not growing anymore. So that decreases as we get older, so we get less of the deep sleep. So it's easier to wake up.
What about sleeping aids? Are those a good thing to use if you can't sleep?
It depends. You should not use a sleeping aid like the only measure to sleep if you have insomnia. Several studies and several organizations, including the American Academy of Sleep Medicine, recommends cognitive behavioral therapy for insomnia. So you need to have, besides medication, you should have some type of therapy for pure insomnia.
You know, we live in such a digital world. We all have our iPhones next to our bed. There are bright lights from our DVR or cable box. What are the outside factors that can impact sleep?
So one, as you mentioned, the digital devices, right, that you too much aware of it. Every time you wake up, you look at the clock, 20 minutes, 30 minutes, I cannot sleep. You get more anxious, you cannot sleep. People that smoke, for example, they always smoke at night. Sometimes the last cigarette is the middle of the night. Nicotine is a stimulant. Coffee half-life could be from 4 to 8 hours. Some people can drink coffee at 8 p.m. and at 10 they should be sleeping. So everybody's different. So noise, of course, the environment can affect your sleep. And don't forget sleep disorders. Sleep disorders are very common.
I want to ask you also, I have a Fitbit. How good are these tracking devices? Are they really accurate, and do you recommend them?
Great point. They give you a gross idea of your sleep, and that's good. That has helped us to identify many people with sleep disorders. The problem is when people pay too much attention to that. I think, okay, my deep sleep was only 5%. Well, we really don't know now that until we measure the brain waves.
Okay. What would you say as we age is the most important thing to remember about sleep?
Healthy habits, like everything in life. Good diet, good environment to sleep. Try that your work doesn't go to the bedroom. Try to isolate your work from sleep. If you are very disciplined at work, with your life, with your diet, the same thing we should be with sleep.
That's so true. Yeah, we are so disciplined with some other things in our life, but sleep tends to go by the wayside. Dr. Alcibiades, we want to thank you so much for joining us.
Okay, thank you.
Brought to you by Polident and Super Polygrip.